What will happen if a person with type 2 diabetes if they keep eating large amount of sugar?
Death most likely. If you don't get treatment, you need to cut down on that. It will catch up to you. At the least, try to eat a high-fiber plant-based meal or snack before you drink those things. The high fiber helps slow the digestion and absorption of carbs and sugars. But even then, you need to cut that sugar down massively. I worked in the ICU and have seen enough diabetics who are non-adherent when it comes to managing their glucose. Losing limbs or digits is actually quite common, as well as blindness, necrotic tissue, slow, painful demise. The one that sticks out in my head the most is the dude who had no lower legs and had such bad venous deficiencies that he ended up with wounds so bad all the skin on his butt and what was left of the back of his legs was gone. Only muscle tissue and fascia was visible, and when we turned him it was like looking at a cadaver. As a non-diabetic still, you probably need to get some mental health care to get that sugar intake under control if you can't do it by yourself. Just from my personal experience, not taking care of yourself while you have the chance will lead you to a slow, painful death where you become a burden to everyone taking care of you. For complications that are usually preventable with good lifestyle choices, change it while you have the chance, because at some point you won't. My college boyfriend's mother had type 2 diabetes and refused to change her diet for many years. She went blind, had a diabetic seizure and fell and hit her head. The nerves in her stomach would randomly go haywire and she'd start vomiting uncontrollably. They had to have an IV in their house to administer fluids when she couldn't stop throwing up. She would get checked into the hospital at least once every couple of months and she eventually died as a result of her disease. Long story short, you suffer and then you suffer and then you die. Meanwhile everyone who loves and cares about you suffers and then they suffer after you die knowing that you could have saved yourself but you refused. If you become diabetic and continue eating the same way without taking insulin, you will feel horrible and your organs will start to deteriorate. It will more than likely be a slow process, but it will get worse until there is no turning back. If you have an accident which results in a wound, your body will not be able to heal itself and you will get an infection. If it is not addressed soon enough, you will have to amputate the wound or you will die from the infection as it will spread to your body. More than likely you will have a heart attack or a stroke before your kidneys become no longer functional. You mean like my father? Who kept drinking alcohol, which quickly is turned into sugar, and also sweets, and then died of dementia? Some medical researchers are calling some types of dementia as type 3 diabetes. There's a huge link to untreated diabetes and dementia.
Lots of good answers already. One thing I didn't see mentioned is Ed. I realize as I'm typing this I don't know your gender. Anywho, if you're a dude it can ruin your sex life.
I finally cut way down on sugar and carbs. The benefits are less pain, better moods and out of prediabetes. I saw 3 people in my family die from it. It's a horrible way to go. If type 2 diabetes is left unchecked, the hyperglycemia will cause both micro and macrovascular damage. This can then lead to commonly known things like heart attacks and strokes. But it will also cause kidney damage, retinopathy that can cause vision loss, cataracts, nerve damage, ulceration, peripheral vascular disease that can cause loss of limbs, and impotence, to name a few. Not diabetic now. How do you know? Have you been to a doctor? Had your blood glucose tested? Do you frequently need to pee a lot? That's a sign of your body trying to get rid of all the excess sugar in your body. How's your eyesight? When my glucose gets out of control for a day or two, Everything starts getting blurry, like I just can't focus onto anything. How old are you? A simple fasting blood glucose test will tell you a lot if it's over a certain amount you are considered a diabetic or pre-diabetic. More involved is a timed glucose test. You start with a baseline fasting result, then they have you drink a sweet drink, redraw blood at 1 hour, 2 hours and the 3 hours. If diabetes runs in your family, you are certainly at risk. Don't put your head in the sand on this. A short story. I work a medical lab, and one day a coworker seemed out of sorts. When I asked what's wrong, she said she hadn't taken her high blood pressure medication. She had forgotten. During our conversation, she told me her brother would not see a doctor about his high blood pressure, which runs in her family. I said, why not? It's very treatable. She said he didn't like doctors. I asked, how is he doing now? He probably is in his late 40s. She said his kidneys failed from unchecked HBP and is now on kidney dialysis. Very sad, very preventable. Don't be like her brother. Best health to you. As a type 2 diabetic, you will die, eventually and painfully. With type 2, your sugar is high over time, which hurts all of your body. So kidneys, liver, lungs, blood flow, brain. Yeah, it's a bad way to go. Now I'm on treatment and have to worry about sugar dipping too low, which I'd rather have once in a long while, maybe once a month, than over 300 sugar like I did for years. A lot of diabetic people died before insulin was a thing. Now you will have better chances, especially with all the new technology like monitoring sensors directly into your skin, fast insulin, etc. But you will still be one missed or overdosed insulin shoot away from death. Source: my husband is diabetic. I just wanted to out a simple answer. You will become even more seriously ill, but you can prevent this. You just need to change habits in your life and you will be so much better, almost completely fine. Good luck to you. You can and will do this. Just remember, you are awesome even when the chaos may seem stacked against you. My dad does this quite often and has type 2. Bro will eat entire boxes of cookies and chocolates. So far he hasn't had any major issues that I've seen, but it will probably catch up to him later. I assume he manages it with insulin. For most, I don't believe accidental sugar intake is a death sentence, but it's definitely not a good practice. One nasty irreversible problem out of sugars can cause is neuropathy. It's never damage due to the high sugars and it is irreversible. And we're not talking about little tingling. In severe cases, it can feel like your feet are on fire 24/7. There's essentially no treatment for it. The meds currently available sometimes help a bit and sometimes not at all. It's misery. As an added bonus, the neuropathy makes you more prone to falls and impairs your ability to feel when something like a cut happens on your feet. So you can cut your foot on a tiny piece of glass, not know it, and an infection sets in. Since you didn't know to wash and treat it, then the infection gets out of control because you're diabetic and pretty soon you have a limb-threatening injury.
You don't get diabetes just by eating tons of sugar. It's not how diabetes works.
Eating sugar does not cause diabetes. Not even type 2. If you were type 2 and ate and drank like that, they would probably put you on insulin injections instead of tablets. But if you kept drinking sugary drinks, your blood glucose would spike every time, causing the typical complications over time: blindness, neuropathy, kidney failure, etc. You will die and likely lose your appendages and eyesight beforehand. It's not just sugar but carbs in general, which break down into sugar. Eating high-fiber foods can help slow down quickly sugars and carbs hot the bloodstream, as well as cinnamon. But it's best to eat as little as possible. Nuts, seeds, meat, eggs, tofu, vegetables, water, unsweet tea, limited fruit, cottage cheese, Greek yogurt, cheese, and whole grains. The less processed and uncooked the better. Anything with flour and sugar needs to be eliminated if possible, or greatly reduced. An extremely slow and excruciating death via cascading organ failure. A friend of mine had type 2 diabetes. He had a huge sweet tooth and would often eat donuts and junk like that. One day he fell into a diabetic coma. Perhaps he wasn't keeping on top of his insulin injections. He ended up dying while being transported to a hospital.
If you enjoyed this video, please check out our playlists full of similar content. Epicaricast is like doom scrolling for your ears. Please like, share, and subscribe.